Well, good morning, everyone. Thank you so much for the opportunity to participate in this exciting conversation about the value of nature in our everyday life. And thank you very much, Dr. Frumkin, for that whirlwind tour through everything we know now about the status of our interactions with nature and what we need to know. So, as you can tell from what's just been said and what you personally experience, the nature pill really has a lot going for it. You don't have to travel to the wildlands to take it. You can see it from inside of a building by looking at tree canopies. You can see it in a small green space in the middle of Manhattan. And you can, as I've just discovered, see it while traveling on a golf cart in some naturalistic area near home. It's very easy medicine to take. The nature pill is low in cost, it's nearly universally available, and despite the fact that many of the studies have shown such a positive influence of nature on human health and well-being, there is a lot less certainty about how much and in what form nature should take to provide these benefits. Several years ago, I started up an interdisciplinary research team with some of my colleagues and students at U of M to try to find out what type of nature pill would most efficiently support mental well-being for a person immersed in everyday life, people like you and me, our relatives, our friends, with our typical array of the stresses and lack of time for anything that amounts to self-care. Some of the motivation for doing this research was also a response to the healthcare professionals in North America and Europe who had begun to write nature pill prescriptions, as you just saw some examples of a second ago, for their patients in order to motivate them to get out. Somehow, if you write that down on a pad, it seems to work a lot better. To write these prescriptions, they were using common sense, and they were using some internal interpretation of the published literature. However, as you've just heard, and as Dr. Bratman, who will be speaking in a moment, showed in a seminal review paper of this work, the studies vary widely in the methods used and the outcomes reached. And so corroboration is difficult. So you're still pretty much on your own when you're prescribing right now. So it was the goal of my group to strengthen the evidence base so that writing a nature pill prescription could be a little bit more profitable in terms of outcomes. The study that I'm about to present is part of a larger research effort in my lab to define the parameters of a nature pill. We ask what dose of nature is sufficient and which form of nature is effective. Now, this last is a very critical issue when it comes to design and planning the dense urban areas around the world. We need to know how we can incorporate in very small spaces just the right amount of type of nature so that people will get this effect. Because if we hope for people to be able to get to a big, large park every time they need to take a nature pill, we're going to be in trouble. So while I won't talk about that today, I will address the first question, what dose? How much interaction with nature is sufficient to restore us mentally? Is it 5 minutes, a half an hour, more? What is it? To answer this question, we did a field study on the impact of short nature experiences on salivary cortisol concentrations. This is a great physiological indicator of stress. At the end, for this particular experiment, we had 37 participants who were recruited by posters and email throughout the city of Ann Arbor and on campus. The mean age of our population was 46. The ages ranged from 22 to 70, so we had a pretty good spread. But the group was mostly female, mostly white, and mostly working as administrators at the university, so approximately in the same socioeconomic category. They agreed to complete an 8-week study through a summer when they were asked to take a nature pill at least 3 times a week and for at least 10 minutes every time they went out. During that time, they could walk or sit or do some combination of those two things. They could choose the outdoor location themselves, but it had to be visually dominated by at least nature elements. Now, this is a very subjective assessment, but that's fine. What we were out for was data from just a regular population doing its thing as opposed to the confines of a clinical trial. The experimental design let the participants use adaptive management to better get themselves outside, which meant that they could adjust how they were running the experiment, on a day-by-day basis, which gave us some pause for the analysis part, but we managed it. So in accordance with our goal of defining a prescription for everyday life, we collected data that did not forego the noise of modern scheduling or the real constraints of life. We did not dictate the time of day for taking the nature pill, except to ask that it not begin for an hour after rising in the morning and did not happen at night after nightfall occurred. The participants were also free to adjust the place that they did this, the duration of the nature experience, in response to their daily changing circumstances. So during this 8-week period, we collected a lot of other self-report data, but during this time, 4 times, we asked them to take a pair of saliva samples, one just before their nature experience and then just after it ended. And then they had to complete a data sheet that addressed their compliance with a few rules that they did give them, or in some cases their lack of compliance. So the restrictions were that there could be no aerobic exercise for obvious reasons, no reading, no conversation, and certainly no social media. And also no eating or drinking within 30 minutes of the point that the saliva sample was taken. So this saliva collection was done with a salivette system. That's the situation where you chew a cotton roll. Those are the kind of things that your dentist uses all the time. You chew for about a minute or so till the thing got really wet, and then you spit it right back in the tube. At that point, you'd label it with time and the time of day exactly and the date. So as you can imagine, the participants really enjoyed this part of the experiment because it was done in public. Some of them developed very good ways of doing this covertly. They kept their samples refrigerated for the duration of the 8 weeks, and then at the end of that period, they brought them back in a chilled fanny pack, which we had given to them at the beginning of the experiment. The samples were then evaluated by the U of M core assay team for concentrations of cortisol. So before moving on to the results, I'd like to take a look at this graph right here. It comes from a study done in 2007 by Nader and his collaborators, and it shows the diurnal cycle of salivary cortisol. You can see that the cortisol goes up sort of in a spike peak right after you wake up in the morning, and then thereafter there's a gradual decline as the day goes on. Our prediction was that taking a nature pill would reduce the stress, and this would be reflected in a drop in cortisol. But you can imagine right away that this presents an analytical challenge because we are looking for the drop in cortisol due to the nature pill, but cortisol is already naturally dropping. So we had to set up a baseline study, which was done at the population level, which is generally not done for cortisol studies. This is important, and this is something that I'll come back to in just a minute or two. So let's take a look at the results. Here is the population-level diurnal response from our sample group. It's based on saliva samples that were collected immediately before the beginning of 110 nature experiences. Its form is visually estimated by the line you see, and it is very comparable to the one that I just showed you that was produced by Nader's group, who also got it from subjects that were allowed to go about their daily life while providing the saliva samples once every hour, but just for one day in their life. Because the diurnal response is curved, our analysis of cortisol on one axis versus the time of day was done by applying a natural log transformation to the raw data. This is typically done for cortisol and a number of other metabolites, and it produces a linearity that makes analysis a lot easier, which you can see here. We got linearity, so we felt confident about the quality of our sampling. We did a mixed model regression, which accounted for the fact that there were some repeated measures among the subjects, and we did it on this log transform data. And the diurnal drop that was defined by our sample population turned out to be 11.6% per hour across the course of the day. So this gave us a baseline. This gave us a baseline to do that all-critical distinguishing between the natural drop in cortisol and the drop we were hoping to see that was due to the nature pill. What we found was this. In summary, the nature pill produced a cortisol drop that was 2 times greater than that produced by the diurnal effect. And this is represented up there in this way graphically. The blue line shows the diurnal drop of 11.6% that I just explained, and the red line shows the drop that we could directly associate with the nature effect. It was 23.1% drop, and this was, again, as I'd like to emphasize, after the diurnal effect was removed from it, after it was accounted for. So these results provide another solid affirmation of the nature experience being mentally restorative, and gets definitely one step closer to doing some kind of quantification that'll be really useful for all the programs that we would like to promote in the population. But to move closer to our real goal, which is to help in the prescription development, we have to translate these results so that they're useful in that way. So, what does everybody want from a good prescription? Well, drug. They want something that works really well, it's got to be fast, and they want something with very few side effects. And given our busy lifestyle, I say from everything that I've seen and that you now know and know yourself, probably the key side effect of a nature pill is the time that it takes to stop and go outside. So no bad side effects. With that in mind, we looked at the data that I've just shown you in a completely different way. We asked whether the benefits of taking a nature pill accumulated at a regular rate, like over an hour, or whether there's a sweet spot, that length of time where you really get the most bang for the buck. Because if we don't have enough time, that's what we want. We want to get as much as we can with as little input as possible. So the time frames that were developed were based on an equal distribution of the nature experience events into 4 different groups, into quartiles. And those time periods were 7 to 14 minutes, 15 to 20 minutes, 21 to 30 minutes, and then over 30 minutes. And for our population, this is almost exclusively people that had a nature pill that lasted between 30 and 60 minutes. We modeled this data, as I said before, as a mixed model to count for repeated measures, but we added a step function for each one of these duration periods, and here's what we found out. If you look at this line right here, you'll see that the first significant effect came from a time period that ran from 21 to 30 minutes. So if you were out somewhere in that time period, the average reduction in stress was 18.5% more than your natural diurnal drop. If you continued on, the benefits accrued, but at a slightly lower rate of 11.4%. So let's go back to that graph I showed you before. I subdivided, well, I didn't subdivide, the program that we ran subdivided those 4 groups into the 4 different slopes that are associated with each time period. So you can see at this point, at this point of the 21 to 30 minutes, we have that 18.5% drop. That is the sweet spot. But I'd like to just say that if you were to take a 60-minute nature pill, you would, this is additive, you would add up the percentage drop for each time frame relative to how long that time frame lasted. It would add up and come to something very close to what our overall population estimate of about a 20% or twice as much drop was. So that's where we are on this particular experiment right now. In short, the results show that the nature pill intervention produced a cortisol drop nearly 2 times greater than the underlying diurnal drop, that the stress reduction benefits were most efficiently delivered when the nature pill lasted from 21 to 30 minutes, with the rate accruing at a slightly lessened rate thereafter, From a time management perspective, 30-minute commitment seems to bring the most efficient payoff. Now, this is particularly interesting because just this year there was a publication by a group of Australian researchers who went at this in a completely different way. They did hundreds of interviews with people about their habits of communing with nature, and then they compared it to their health profiles. And what they found was that for people that spent 30 minutes or more outside, there was a 7% drop, or they had 7% lower incidence of depression and a 9% lower incidence of high blood pressure, cardiovascular problems. And they went on to extrapolate out into an economic model, and it was going to save Australia something like $240 billion just to have this reduction in those two key health problems. So you can imagine the extended benefit of getting people to go out for 30 minutes a day. We were kind of satisfied to see that both studies came up with the 30 minutes, but the caveat here is that we know so far from our self-report data, which is still in analysis, that the time that people perceive a shift in themselves, how stressed out they are, what their mood is, how energetic they feel, and things like that, is a shorter time period than the 21 to 30 minutes. It looks like it's closer to 10 to 15 minutes. So I would just like to say that I hope this data that we have so far, these results that we have so far, are useful for the physicians that are trying to come up with nature pill prescriptions that are going to be reliable. But stay tuned. In a very short period of time, we'll know whether there's some kind of adjustment. And the reason that we think that self-perceived information is critical here is that there's a little bit of a time lag in when cortisol shows up in the blood and in the saliva. This is based on some comparative tests with another stress marker called salivary amylase. So we think that the issue of time may have to include the situation that the cortisol response physiologically is not measurable exactly when it begins to happen. I'd like to say finally that we established an approach that can be used by a lot of people to test a greater diversity in the population, including more men, more non-white participants, and more people at the edges of the population, particularly children and the elderly. Our work continues, but in the meantime, we do hope that all of us are providing experimentally will be useful to you. Oh, you didn't get to see those results. I'd also like to thank the collaborators that I had for this specific experiment, Dr. Brenda Gillespie, Sophie Chen, and Alfred Lee, and financial support from the TKF Foundation, who's doing incredible work on making urban places green and supportive of mental and spiritual well-being. That's their goal, as well as an M-Cubed grant from the University of Michigan. Thank you.